The rate of vaccinations in the U.S. continues to decrease despite the spread of the Delta variant. According to the latest data from the CDC, the average daily count of first doses is at roughly 398,000. That's down more than 30% in a week. The Delta variant is fueling surges in areas with lower vaccination rates. It's also become the dominant strain in the U.S. The World Health Organization says it's spread to at least 98 countries. On Tuesday, President Biden stressed the importance of getting more Americans vaccinated.
Study after study after study has shown that since early May, virtually every COVID-19 hospitalization and death in the United States has been among the unvaccinated. So if you're vaccinated, you're protected.
For more, I want to bring in Alex Tin. He's a CBS News reporter covering the pandemic. Hi there, Alex. Thanks for being with us. So the president fell short of that July 4th vaccination goal that he had outlined, but he's changed course a little bit on trying to get Americans vaccinated. What exactly does this entail?
Well, listening to the president's remarks earlier today, listening to White House officials talking about this address that they expected to come for some time now, what was striking to me was actually what we didn't hear, which is any new grand idea or plan or program to really close the gap and increase the pace of vaccinations here in the United States. You just mentioned those figures. You know, it's the lowest that the pace of vaccinations has been since the beginning of the vaccination rollout last year. And that slowing pace of vaccinations, which has continued to slow for weeks and months now, is something that the Biden administration spent all last month implementing a lot of programs and efforts and policies and outreach and national tours and grassroots efforts to try to essentially get out the vaccine and encourage people to get those first doses. And as you heard, both from the president and from his officials over the past few weeks, the pace of vaccinations in the United States just wasn't going to be enough to meet that July 4th goal. And many of the programs that they announced today, for example, increasing shots available to primary care doctors, available in, pediatricians' offices, increasing worksite vaccinations, all of those are programs that we've heard federal officials not just talking about for weeks, but touting as the key to reaching that July 4th goal. So if anything, at this point, what we've heard now is an emphasis that closing those final gap of people who need to get their first doses, that's something that's going to be up to the states, obviously, with the federal government's help.
Yeah, I want to talk a little bit more about this spotlight that will now be on the states, because COVID cases are rising in nearly half of all U.S. states. And according to USA Today analysis of Johns Hopkins University data, it shows that rise. So what exactly are these states doing to try to fight this upward tick in cases?
Well, you've heard a variety of strategies implemented by both states and localities, cities, towns, counties, in terms of trying to curb the spread of COVID-19 among unvaccinated people in their jurisdictions. Some of that is to do with people that we know are immunocompromised, we know potentially aren't eligible to get the vaccine yet. Very old people, people in nursing homes, people who are receiving certain kinds of treatment, and then obviously younger children who aren't eligible for the vaccine yet. And there are major decisions coming up, especially as, school districts get back to the return to school planning that they're going to be doing in light of both the Delta variant and growing vaccination rates, that they're going to need to make a decision about how they're going to implement all of these policies we've accumulated over the past year in the context of nobody being vaccinated. And now so many people are vaccinated and want to go around not wearing masks. So that's one bucket of the focus that a lot of states and localities are right now debating. The other is obviously focused on treatment and prevention. Some of it is increasing vaccinations. It's the same thing that we've heard for months, trying to encourage and incentivize people to get those first doses. But aside from that, increasing the ability of treatments to reach and support those people who actually do get sickened with COVID-19. We've had a really growing roster of drugs and treatments that have been more and more effective at both preventing or reducing your risk of severe disease and ultimately death from COVID-19. We've seen a real effort to make it easier to access those treatments like monoclonal antibodies. Recently, the FDA authorized a whole new set of monoclonal antibodies and some changes to some monoclonal antibodies to make it easier to get them without requiring, a complicated setup and doctors and technicians. And we're probably going to see a continuation of that, both on the federal, state, and local level as they try to tackle these two fronts. But again, nothing groundbreaking, nothing new here. Really, in some ways, it's more of the same, but in the context both of growing vaccination, vaccine hesitancy, and then obviously these new variants.
Right. And as these states are trying to get more people vaccinated, there are also some questions about people who are already vaccinated. I wanted to ask about this Wall Street Journal report over the weekend that said that some vaccinated people in the UK are still dying of COVID. But scientists actually don't seem too worried about this. How do you explain that rationale?
Well, and to be clear, that's something that we've seen right here in the United States. The CDC publishes on a semi-regular basis a tally of reports they receive. Again, these are voluntary passive reports, so it's not a scientific measure, but reports they receive from health departments saying, these are the number of people who we have, recorded in our jurisdiction who are hospitalized or have passed away potentially from COVID-19, who were also fully vaccinated against COVID-19. Now, this number, to put it in perspective, is very small. And experts have said from the beginning, number one, the vaccines are not 100% effective. They're close to 100% effective in some cases at preventing severe illness or death, but not 100% effective. So that's one of the big reasons. The other big reason that we know about, and I just mentioned it a little bit a couple minutes ago, is that real question of immunocompromised people and people who potentially, even when they do receive those vaccines, aren't necessarily mounting the kind of immune response you would hope to see from otherwise normally healthy individuals.
That is a good reminder. And of course, vaccines have been proven effective and people should still get them. And, the big question today, too, at the White House, at least, and the president brought this up, was this, Delta strain. That's been top of mind for a lot of folks. Can you remind us how effective the vaccines that are available right now are against this new strain?
Well, it's been a moving target. I mean, we know big picture. We've heard it from federal officials. We've heard it from international health officials that we know that the vaccines on a macro scale appear to be effective both at curbing the transmission of COVID-19 as well as on a personal level, reducing your risk of getting a severe illness, being hospitalized, or dying from COVID-19. Now, where it has become a bit of a moving target is when you ask the question of, well, how effective has it been in light of the Delta variant? How much has it changed since those really high effectiveness figures we saw, for example, with the Pfizer and Moderna mRNA vaccines, which were so robustly effective way back in the beginning when they were first authorized? We saw some data from the United Kingdom earlier this year that suggested its effectiveness against symptomatic infection. That's any symptoms you get from COVID-19. Being around 88%. There was some data that Israeli health officials announced over this past weekend that puts that number potentially a little bit lower, around 64%. And even in that case, Israeli health officials said, well, the effectiveness still seems very high against severe illness and death. But even with that being the case, it does raise an interesting question, a worrying question for officials both here and abroad when they measure whether or not it's going to be necessary to reimpose some of these public health restrictions that we've seen earlier in the pandemic and abroad. If you're now concerned again about more and more people who are fully vaccinated, maybe not getting severely ill, maybe not getting severely sick, but potentially having symptomatic infections and spreading it to others.
Yeah, and that was a question at the White House today. Alex, we're also coming off of a big holiday weekend, which means that lots of people were out there traveling. And we're seeing restrictions ease in some countries like the UK and Canada, and that's prompting some more questions about these easing of travel restrictions. So from where you see it, have travel restrictions proved effective at all in slowing the spread of the virus over the course of the pandemic?
Well, there are two ways we can look at that question. We know that there have been these big meta, systematic reviews of lots of studies that looked at travel restrictions and that said that, okay, you can point to, for example, travel restrictions that were implemented earlier in the pandemic and say, based on these studies, potentially X or Y number of people avoided getting COVID-19 or got more mild COVID-19 case spread in their communities as a result of these travel restrictions. So that's one way you can look at it. But obviously another way, and what has driven a lot of the recent travel restrictions we've seen both in the United States and abroad, was the concern about potentially reducing the risk of these worrying variants, like the Delta variant, which was first spotted in India, from entering the United States in the first place. And if that's your question, which is, do they work at preventing the entrance of these worrying variants into the United States? I think the conclusion at this point is probably no. I mean, we know that these travel restrictions maybe are reducing the spread of COVID-19, but are not preventing the entrance of these worrying variants. And obviously the case in point, not just being the Delta variant, but now the more worrying Lambda variant that some international health officials and federal health officials have said they're worrying about. That's the C37 variant, which was first spotted in Peru last year in December. And we know now that since December, even though this variant hasn't been spreading as fast or widely as Delta, at least not yet, that when you look at the statistics that have been reported, say, to Outbreak.info, which is a great source that has been tracking different labs around the world that have spotted these variants, the C37 variant, which, again, hasn't been spreading a lot, is still early. We're not 100% sure if it's going to be a variant of concern. That's already in the United States in more than 40 states. At least labs have spotted it in more than 40 states. So when in light of this question of does it work against stopping variants, probably not. Will it work potentially in reducing the future spread of COVID-19? I think that's going to be the subject of research for probably years to come.
All right, Alex Tin, still so many questions with this pandemic, and you've helped us answer so many of them. Thank you for your time today. We appreciate it.
Thank you.